Hi everyone, my name is Peter. Welcome to my YouTube tutorial. In this section, we are going to continue with the anti-seizure drugs. In today's class of drug we have is Gabapentin. So in our objective, we shall have the mechanism of action of the drug, the pharmacokinetics, the side effect, and some other information that I'll put forth as far as Gabapentin is concerned. So now, to begin with the first objective, the mechanism of action of this drug. We've seen a lot of these anti-seizure drugs, and we see that most of them inhibit the sodium channels, the calcium channels. Others have enhanced GABA, others inhibit the glutamate. So with the gabapentin, what it does, that it has two proposed mechanisms of action. And the first one is that gabapentin was designed to be a GABA-mimetic drug. Metric drug. So meaning that it has to resemble the analog GABA, so that it binds on the receptors to elicit what we call the excessive chloride ion influx, leading to hyperpolarization of the post-synaptic neuron. But this drug, what the real mechanism of action that it has is that it inhibits what we call the GABA transaminase enzyme. So this enzyme is important in breaking down of GABA transaminase. So when this enzyme is inhibited, we shall have more GABA at the presynaptic, then we shall have more inhibition as far as GABA mechanism is concerned. So this will lead to the lessening of the excessive firing seen in postsynaptic neurons during this seizure period. Then another proposed mechanism is that this drug gabapentin binds allosterically to the calcium ion channel. So the word allosterically means that you do not bind to the receptor at the active site, but rather you look for the drug binds to a different site other than the active site, so that this changes in the conformation of the receptor, and hence no more of calcium ions will be able to bind to the active site. So this drug will bind allosterically to the calcium channels, and also remember calcium is important in the propagation of these nerve impulses. So therefore we shall have a lessening of this activation of the calcium channels, hence stopping this condition as is seen in seizures. So basically, these are the two proposed mechanisms of action of this drug. So if we go to the pharmacokinetics of this drug, so we have an absorption. So this drug is well absorbed, and approximately 60% of the drug is absorbed into the blood. So this is the bioavailability. And at low doses, we have a very high bioavailability, but at high doses, the bioavailability drops down because of what we call the L amino acid transporter. So this transporter helps in transporting these amino acids. Remember, gabapentin is an amino acid because it has the amine and the carboxylic acid group. So it inhibits. When you have low doses, most of the drug you have will be transported by this transporter. But if you have an excess, then not all of it will be taken into the body. So usually this L amino acid transporter is found in the intestines, and it affects the bioavailability of this drug. So therefore, that's a point to note as you're giving this drug in increasing doses. So then when we look at this distribution, this drug is not protein bound. It's not protein bound. So therefore, we shall have minimal effects as far as protein binding is concerned, and also it goes straight to the site of action, so it will not linger around with the plasma proteins. Then we have its metabolism. This drug is not metabolized by the P450, not metabolized by the cytochromes P450 enzymes. So therefore, we shall have minimal drug-to-drug interactions as far as using this drug is concerned. And under its elimination, this drug is eliminated unchanged in the urine. So it's eliminated unchanged in the urine. So therefore, this is the pharmacokinetics of gabapentin. So if we drop down to the side effects, some of the most side effects we've been seeing as far as anti-seizure management is concerned, we have ataxia, dizziness, moderate sedation, then a little bit of anxiety, nausea, and then vomiting. Basically, these are some of the most common side effects seen with the drug. So therefore, basically, that's it as far as gabapentin is concerned. See you next time as we discuss more anti-seizure drugs. Bye for now.